Chapter 3 Tissues. Connective. Membranes. Muscle. Nerve. Connective tissues. Cells rarely touch due to extracellular matrix. Matrix fibers and ground substance secreted by cells. Consistency varies from liquid, gel to solid. Does not occur on free surface. Good nerve and blood supply except cartilage and tendons. Cell types. Blast-type cells retain ability to divide and produce matrix, fibroblasts, chondroblasts, and osteoblasts. Site-type cells mature cell that cannot divide or produce matrix, chondrocytes and osteocytes. Macrophages develop from monocytes. Engulf bacteria and debris by phagocytosis. Plasma cells develop from B lymphocytes. Produce antibodies that fight against foreign substances. Mast cells produce histamine that dilates small bV. Adipocytes, fat cells, store fat. Connective tissue ground substance. Supports the cells and fibers. Helps determine the consistency of the matrix. Fluid, gel or solid. Contains many large molecules. Hyaluronic acid is thick, viscous and slippery. Chondroitin sulfate is jelly-like substance providing support. Adhesion proteins, fibronectin, binds collagen fibers to ground substance. Types of connective tissue fibers. Collagen, 25% of protein in your body. Tough, resistant to pull, yet pliable. Formed from the protein collagen. Elastin, lungs, blood vessels, ear cartilage. Smaller diameter fibers formed from protein elastin surrounded by glycoprotein, fibrillin. Can stretch up to 150% of relaxed length and return to original shape. Reticular, spleen and lymph nodes. Thin, branched fibers that form framework of organs. Formed from protein collagen. Connective tissue, loose connective tissue, dense connective tissue. Cartilage. Bone. Blood. Lymph, loose connective tissues. Loosely woven fibers throughout tissues. Types of loose connective tissue. Areolar connective tissue. Adipose tissue, areolar connective tissue. Cell types fibroblasts, plasma cells, macrophages, mast cells and a few white blood cells. All three types of fibers present. Gelatinous ground substance, areolar connective tissue. Black equals elastic fibers. Pink equals collagen fibers. Nuclei are mostly fibroblasts. Adipose tissue, peripheral nuclei due to large fat storage droplet. Deeper layer of skin, organ padding, yellow marrow. Reduces heat loss, energy storage, protection. Brown fat found in infants has more blood vessels and mitochondria and responsible for heat generation. Dense connective tissue. More fibers present but fewer cells. Types of dense connective tissue. Dense regular connective tissue. Dense irregular connective tissue. Elastic connective tissue. Dense regular connective tissue. Collagen fibers in parallel bundles with fibroblasts between bundles of collagen fibers. White, tough and pliable when unstained, forms tendons. Also known as white fibrous connective tissue. Elastic connective tissue. Branching elastic fibers and fibroblasts. Can stretch and still return to original shape. Lung tissue, vocal cords, ligament between vertebrae. Cartilage network of fibers in rubbery ground substance. Resilient and can endure more stress than loose or dense connective tissue. Types of cartilage. Hyaline cartilage. Fibrocartilage. Elastic cartilage. Hyaline cartilage, bluish shiny white rubbery substance. Chondrocytes sit in spaces called lacunae. No blood vessels or nerves, so repair is very slow. Reduces friction at joints as articular cartilage. Bone, osseous, tissue, spongy bone, compact bone. Sponge-like with spaces and trabeculae. Trabeculae equals struts of bone surrounded by red bone marrow. No osteons, cellular organization. Compact bone. Solid, dense bone. Basic unit of structure is osteon. Hyaline system. Protects, provides for movement, stores minerals, site of blood cell formation. Compact bone osteon equals lamella, rings, of mineralized matrix. Calcium and phosphate give it its hardness. Interwoven collagen fibers provide strength. Osteocytes in spaces, lacunae, in between lamella. Canaliculi, tiny canals, connect cell to cell. Blood connective tissue with a liquid matrix equals the plasma. Cell types equals red blood cells, erythrocytes, white blood cells, leukocytes, and cell fragments called platelets. Provide clotting, immune functions, carry O2 and CO2. Lymph, interstitial fluid being transported in lymphatic vessels. Contains less protein than plasma. Moves cells and substances, lipids, from one part of the body to another. Membranes. Epithelial layer sitting on a thin layer of connective tissue, lamina propria. Types of membranes. Mucous membrane. Serous membrane. Synovial membrane. Cutaneous membrane, skin. A. Mucous membranes lines a body cavity that opens to the outside. Mouth, vagina, anus, etc. Epithelial cells form a barrier to microbes. Tight junctions between cells. Mucus is secreted from underlying glands to keep surface moist. B. Serous membrane, simple squamous cells overlying loose CT layer. Squamous cells secrete slippery fluid. Lines a body cavity that does not open to the outside, such as chest or abdominal cavity. Examples: pleura, peritoneum and pericardium. Membrane on walls of cavity equals parietal layer. Membrane over organs in cavity equals visceral layer. D. Synovial membranes. Line joint cavities of all freely movable joints. No epithelial cells, just special cells that secrete slippery fluid. Muscle cells that shorten provide us with motion, posture and heat. Types of muscle. Skeletal muscle. Cardiac muscle. Smooth muscle. Skeletal muscle cells are long cylinders with many peripheral nuclei. Visible light and dark banding, looks striated. Voluntary or conscious control. Cardiac muscle cells are branched cylinders with one central nuclei. Involuntary and striated. Attached to and communicate with each other by intercalated discs and desmosomes. Smooth muscle spindle-shaped cells with a single central nuclei. Walls of hollow organs, blood vessels, GI tract, bladder. Involuntary and non-striated.